Hey, you came back. Well, I mean, I did too. So we really got a few things to talk about. I mean, well, what did I miss? I've been gone a little bit. I mean, I've been out of the loop for what, 4 days? I think so. So, anything happened while I was gone? I really didn't even... I've been out of the loop, to say the least. I will get into my... I want to know, what's been going on. You miss me? But really, in all seriousness, how are you? How have you been? Doing good? I mean, I know you can't really. I mean, you can comment if you want. So I've been kind of thinking, how do I best present... I know, I'm going to rock this beard for a little bit, I think. It's kind of hard to shave at the moment. But I've been trying to think, what is the best way to go over my experience of this surgery? I did vlog while at the hospital, but it really just ended up being kind of a log of what was happening throughout the day. You know, like if you did bullet points to summarize the day, and it's not even that interesting to me, and it does, well, it needs further explanation. So I don't think I'm gonna... The best way really is just to tell a story and insert some few shots of me at the hospital there. So that's what we're gonna do now. So bear with me. I'm moving extremely slow, and you know what? We'll get to the whole, how are you doing? How's your pain level? How do you feel? Did it help? We'll get into all that stuff, especially if you have a back injury and you really want to know. And I mean, feel free to leave me a comment and ask me anything back related, especially if you have a back injury. That's kind of the whole point of this. So, well, let's dig into my surgery. I mean, no pun intended. I guess it would have been better if I said, well, let's cut into this, or let's go. As you can gather from the previous vlogs, I was a little anxious, I was a little nervous, I was a little stressed out about the surgery, mainly because I had no idea what was going to happen. Putting all that aside, if you want to know more about that, watch some of the previous vlogs, get caught up a little bit. Just heading out, just recounting the day of surgery and heading out, and going out early in the morning and it's dark out, and it's just an odd feeling. And then as soon as we get in the car, it just starts to downpour. And then by the time we get to the hospital, the sun's starting to come out and the rain lifted a little bit. And then just, I don't like hospitals to begin with, as I'm sure most people don't. There's always, if you're in a hospital for any reason, it's usually not a good reason. I mean, aside from having a baby or something like that. But for the most part, it's usually somebody sick or somebody died or something, at least for me. That's what my hospital visits have been like. So, hospitals and me, I don't really like them at all. So getting into the hospital and get into the flow of how the hospitals work. And even though the surgery's scheduled, there was a lot of waiting. And when you're already anxious about the surgery to begin with, waiting doesn't really help much. You kind of just keep building and building and starts amplifying everything you've been thinking, because you got nothing else to do besides think and say, well, how is this gonna go? And then when they kind of surprise you with things, like they had to draw blood to get a blood sample from me just in case I needed a transfusion, and then I had to sign paperwork saying that I accepted transfusion. And the whole purpose of that was just in case when they're cutting into me, they nick, a vein or an artery or something goes wrong where I have a large amount of blood loss that, well, they have to replace that blood somehow. And I'm saying, yes, you can do that. And, just for my wife to fill out, the proxy stuff, so to where, in case something does happen and I'm like brain dead and there's no hope that I'm ever going to come back, and there's decisions that have to be made that obviously I couldn't make myself because, well, I can't. But signing that paperwork and talking about that stuff makes things very real. I mean, it's just like, it adds to everything else that you've been feeling for the day. So getting all that stuff done, it adds to everything. Having blood drawn so that they can know my blood type, they can test for that, was kind of a surprise. The nurse came in, she's talking to me and stuff, I can see the fresh package of the needle and such there, and okay, that's not good, because she didn't say it's happening yet. And it's there. Well, why is it there? It's there for a reason. She's gonna do something. but nobody's told me yet. Okay, so now I can start to feel it. My heart rate's getting elevated. I can start to feel it. It's not good. And then she proceeds to tell me what she has to do. And it's like, okay, well, you do what you have to do, but I'm going to warn you, I have a past history of fainting. This is what it is, and I'm going to talk through it while you're doing it, because usually talking kind of helps it a little bit, or helps me a little bit. It's more mental than anything. So she takes the needle, throws it in my vein and all that stuff, whatever she's got to do. You barely feel it. It's just, my daughter pinches and bites worse than what this needle feels like. So it's not the pain that gets me. So why does it get, it's all up here and I can't control it, at least not yet. And that's what drives me nuts. So whatever, she completes it and I can feel it. I know when it's coming on. I get really, really hot. I get real sweaty. It's hard to breathe. It's hard to talk. I just gotta concentrate on breathing. People ask me, are you okay? I can't respond. I'm really slow to respond. Chris, are you okay? Are you there? Are you with us? Yeah, I'm gonna pass out. Are you with us? Are you with us? Because, passing out is one thing. It's essentially whatever reason your heart isn't pumping blood to your brain and stuff. Your heart's restricting all the blood and keeping that blood on its core organs and stuff to keep you alive. So it's a fight or flight response. It's natural, but it's what's going on. The other drawback is if I pass out, well, the nurse may not be able to catch me and I could fall, I could hit my head. Something else worse could happen. That's the general census that I get from passing out. So I'm there, nurse is like, put your head between your legs, get your head lower than your heart so that the blood starts flowing back into your head so you don't pass out. Okay, so I'm doing that, I'm down there, I'm breathing, head between my legs the best I can. I'm breathing, I'm still feeling it. And then it gets to a point where it's like, I'm passing out. I know I'm passing out. It's happening, I can't respond anymore. No matter how hard I try, I can't respond. Everything's going, it's all shrinking and everything. And next thing I know, they get me reclined in the chair and I passed out. Maybe not full-blown passed out, crack open the smelling salts and get me back and going, but passed out to where it's like, well, I had a big drop in my blood pressure. The blood wasn't getting to my brain and I was shutting down. So, put the cold washcloth on my head, all that stuff, get back into it, start breathing again. That's me passing out number one. If you want, keep count how many times I pass out. I'm recounting the story. I might forget how many times I pass out. But that's number one. Okay? So the problem with passing out, then my head starts to feel like garbage. I start to get a headache, everything like that, and it starts to be easier to pass out the next time. Keep that in mind. Okay, so now there's more waiting. That nurse is done doing what she has to do. I got my hospital gown on, everything's off, my rings and everything are gone, and I'm waiting. I'm waiting for transport. Someone's gonna take me to pre-op. Either way, I gotta go to another room. So they finally come in, and I warn them. I'm warning everybody. You know what? I just passed out. I know we're not doing needles or anything, but I'm just warning you. Just in case of anything, I'm in this wheelchair. I don't need to pass out while in the wheelchair and fall forward while we're moving through the hallways or something. I'm warning everybody. So as we're going down the halls, all I remember is just the cold air rushing by my face, you hearing the wind against your ears. It's not like we're moving fast, but it's just a sensation. It's the fluorescent lights going past you in the hallway. It's the sound that the wheelchair is making on the tiled floor. It's the little bumps that you hit getting into the elevator or going up a little incline or something like that. And they wheel me into the I'm gonna call it the pre-op room. I forget exactly what it's called, but that's what I'm gonna call it. They wheel me into there. I have to get on this bed or gurney or whatever you want to call it. It's a mobile bed, so I have to get on there. That's fine. That's not an issue. That's not a problem. I get to lay down. So if I pass out, at least I'm not gonna fall anywhere because I'm already laying down. And I know what's happening next. They're getting me ready to go into the operating room. So I know they have to put an IV in. The anesthesiologist comes in. He's very nice. And that kind of puts me at ease too. And just the same, I mention to him, you know, I'm not good with needles and all that stuff. And for the purpose of the story, every time I tell, I'm just going to say I mention I'm not good with needles, just to kind of keep stuff short. And he explains, oh yeah, don't worry. They all say the same thing. It's like, okay, well, I know this, but I'm telling you, it's going to happen. I'm telling you, it's going to happen. He's very good. He, you know, takes my hand, puts Novocaine in there to numb everything up, puts the IV in my hand, tapes it up real nice. I don't feel it. I'm doing good. Don't pass out this time. So I wonder if I passed out more or less every time I had needles and IVs and such put in me. Let's keep count. We're 1-1 right now. Oh man, put the score up on the board. Maybe that's what I'll do during editing. So I'm waiting there. And then other people come in, they introduce themselves, a couple med students come in, a couple other doctors that work with my surgeon come in, everybody's introducing themselves, my surgeon comes in real quick. I talk to everybody and everything like that. We're getting ready, and talk to the med student, ask her if she's allowed to take pictures and video, because, well, you know, that'd be kind of cool to put that in the vlog here. Of course, I would warn you first before I'm putting up video of them, like, you know, doing the surgery on me. But just the same. And then I'm talking to some of the other people that are in the room. I forget who they were. I apologize for that. But I'm asking, am I going to have a breathing tube? Am I going to have a catheter? Are they going to put that stuff in after I'm already under the anesthesia? Because, well, you know, that stuff doesn't seem pleasant. And they're like, oh yes, absolutely. Putting the breathing tube in is not pleasant at all. We do that while you're asleep. And I'm like, okay, thank goodness. They're telling me that I'm going to be prone during the surgery. Well, obviously, you're doing back surgery. I'm going to be laying down. I kind of figured that. I asked, you know, do they do that just the same after I'm asleep and such? And they said yes. So, okay, there's not much I have to worry about. I just got to lay in this bed and wait. More waiting. And they tell me, okay, you know, it's past the time of my scheduled surgery. Not much, but it's past. So, you know, you're waiting and waiting. You know, they had surgery in the morning before you. We're cleaning up the OR. We're getting you ready. Okay, more waiting. And then just the same, transport comes. They start to take me out of the room. It's the last time I get to say goodbye to my wife. And it's about the time I get to start to time travel. It's getting really close to time travel. You know, set the dials on the DeLorean, make sure the flux capacitor is working. We're almost up to 88 miles per hour. We're almost good to go. Just the same going through the halls, you feel the rush of the air. You experience that. It's just like you're noticing these things that you wouldn't notice because, well, maybe I'm trying to keep my mind off of things. Big doors open to the OR. You see all these instruments, you see all these big lights everywhere, you see people. I'm trying to count the people, how many are in there, how many people are going to be in there working on me and stuff. And then I don't remember them putting the mask on me. I don't remember them doing anything. I don't remember them saying, you know, count down from 100 or anything like that. I really think they just did it maybe through the IV. I'm not 100% sure. I do not recall what happened. But all I know is, that's all I remember. That was the last thing I remember, was just laying on that thing, laying on that bed, and just looking at the people around me. And then I'm out. And then, so there's the surgery that takes 3 hours. And then after the surgery, you're in recovery for 2 hours. You have to be, until you're awake. I do not remember being in recovery. I'm trying to recall being in recovery. Obviously, I was in recovery for 2 hours. Obviously, I was coming off of the anesthesia and stuff like that. I don't remember it whatsoever. And by the way, I did mention everybody too that I am prone to being nauseated from the anesthesia. I don't want to be throwing up afterwards. I mentioned this in the previous vlog as well. So they made sure they gave me extra stuff for that, all through the IV and stuff. So that's cool. But I don't remember waking up in recovery at all, unless it was the same room as the pre-op room and I'm just getting my memories confused. So now, what I do remember next is waking up, and I'm pretty sure I woke up in the hallway being transported from recovery to my room. And I want to say it's a long ways away. It's at least a 16 floor difference. So there's a point where I woke up in recovery and they said, you're good to go. And we're going to your room in the elevator, 16 floors, through all these different hallways and stuff. I don't have any recollection of that at all. I remember being on the 16th floor, going down the hallway a little bit, and going into my room, and then my wife walking in, like, even before they could put the bed by the window. Now, side note here, or tangent here, my wife was waiting in the waiting room up on the 16th floor already. They had told her, oh, he's going up, he's done with recovery, he's going up there. She's waiting and waiting and waiting. And there's other people waiting up there too for people to come out of their operations. And the elevator's open, they're pushing somebody out, she can't see who it is. She happens to see my knee. My knee's like exposed, it's out of the covers, and she's like, oh, there's Chris. The fact that I can be recognized by my knee is kind of funny. And you know what, there's another story I might tell in a couple days, just the same, about something similar to that, how I recognized my sister after she had a car accident. And it's a whole nother story. We'll tell it a different day. But my wife comes in the room. I'm out of it. I'm not really, I mean, I know what's going on, but it's hard to get the words out. I'm just thinking very slow. It's hard to connect that I'm thinking and I want to speak and what I want to say. My throat is extremely dry.
I want some ice. I want some water. Something.
A lot of that's the anesthesia and the medication and stuff. And I don't like medication for the side effects. I don't like medication because I get a headache as a side effect. Anyways, that's a side note. We'll go over that later. So the surgery's done. That's my time travel. It's done. 5 hours have passed and I don't remember any of it. I time traveled into the future. 5 hours. That's pretty cool when you think about it. I mean, under the circumstances, but in the same regards, I don't even feel anything, and it's all the medication that's going on, I'm sure. Otherwise, I would feel it. Just the same. I'm coming out of this grogginess. I'm starting to wake up more. I'm asking my wife questions and stuff like that. So we're in the recovery room. I'm done. Yay, successful. One hurdle of this surgery done and over with. Now it's on to recovery. There's a few things you have to worry about after you have surgery. One is any type of infection. 2 is like pneumonia, catching pneumonia. 3, meningitis, I think it is. And then with my surgery as well, I have to worry about spinal fluid leakage that could affect things. So I'm telling the nurses everything. I'm telling them everything I feel because I don't know what symptom is going to be a symptom of something that's more serious. And blood clots as well. So there's reasons for everything that they're doing. I understand all this. I'm asking questions. Maybe I'm asking questions to be more inquisitive than most people would be. I don't know. I like to know what's going on. I like to know how things work. I like to take things apart and really see the intricacies of everything and how stuff works. But that's me. That's how I think. So because the 4 days in the hospital kind of merged together and they all just felt like one very, very long day, I get a little confused on the events that happen next. So I might pause just for a minute here, just to go over the events that I recorded and kind of logged, so that I at least have them in order for you. So give me 1 second. So not long after I've actually woken up, after surgery, after I've actually been in my room that I'm going to be in for a couple of days, PT, the physical therapist, comes in and they want me to get out of bed. I mean, I just had major back surgery. I don't know what the protocols are. I don't know what's normal. But I mean, I kind of just want to, rest for a little bit. I don't want to move. I'm still out of it from the anesthesia. Now I'm still trying to get my senses back. But just the same, I listened to the physical therapist on how to go from laying on my back to laying on my side. You got a log roll. You can't do certain things. And before all this, he asked me, do you know what you're not allowed to do? And I said, well, probably bending, twisting, and lifting. And he's like, well, that's absolutely right. Who told you that? It's kind of just, I kind of figured that's what I can't do because it makes sense. The BLT, bending, lifting, twisting. But regardless, so he's telling me how to log roll, which I already knew this. How to log roll from my back, laying on my back to laying on my side, and then how to get my knees right to the edge of the bed. And as I'm swinging my feet down, I'm pushing up on my elbows to get myself sitting up straight. And then from there, how to bend, I should say pivot at the hips, not bend your back, but pivot at the hips to get my center of gravity over my knees and feet so that I can squat, use my legs to stand up and get vertical. Okay, so just sitting up was a chore. I'm breathing, and then standing up, I can start to feel it. I'm getting hot. I'm getting all sweaty, and I'm like, I'm gonna pass out. I'm telling them, I'm gonna pass out. All right, Chris, are you with me? Are you with me still? Are you still with me?
I passed out. I think we're gonna count the number of times I pass out. It's a lot.
So they say, you know what, you're not doing physical therapy today. And I'm kind of happy about that, but then in the same respect, it's like, well, is this going to put me back a day from getting out of the hospital? You know, I mean, had I done physical therapy and done well with it, then that might have been one less day I spent in the hospital. That's how I'm thinking. And it's like, well, I feel like garbage. I just want to get out of here. I want to go to sleep. This bed they have me on is not comfortable. So now we get to the normalities of the day, you know. Drinking, eating, hydrating, stuff like that. Although I haven't eaten anything yet, I'm still hungry. It's getting close to dinner time. My wife has to go back home, and she's been there all day. Don't forget, just sitting and waiting. She's got to go see the kids. My sister's been with my kids all day. You know, gotta have a shift change there. So my wife leaves. I get dinner. I can't sit up in the bed to even eat dinner. So like the tray's like right here, and I'm scooping out whatever's, you know, the Jello, and I'm trying to eat. I can't see what's on the tray, so I'm using my phone to kind of see what's on the tray to figure out what I even want to eat, because I don't feel like eating at all. I know I have to eat.
Can't quite sit up, so using the camera to kind of see what I have to eat, it works out pretty good.
Regardless, get through dinner and all that stuff. And then there's a shift change with the nurses, which is cool because you get to meet new people. And I don't have an issue with that or anything, but I get to talking to this one nurse later. I mean, it's like late. I mean, late. They're coming in all the time, so there's no time to sleep. As soon as you start dozing off, a nurse is coming in, checking your vitals, and another nurse is coming in, giving you meds, and it's just non-stop. And then, you know, earlier in the day, you had the doctors coming in, you had the med students coming in, and there was like 5 med students, and they all came in either all at the same time early in the morning or one at a time later in the day, do the same thing. But regardless, so it's late. I'm talking to this nurse for like, I swear it was like an hour and a half. He's telling me all these different stories about hunting, about shooting, about how he was a combat medic and stuff like that. And then at some point, really late in the night, transport comes up and they want to do x-rays. All right, well, I warned him, you know, PT tried to sit me up earlier and I passed out. So you're going to try to put me in this wheelchair, and the odds of me passing out are very likely. And he's like, well, do you want a wheelchair or do you want a gurney? Okay, well, that depends upon if they're going to have me laying down for the x-ray or if I'm going to be standing. If it's going to be standing, I want a wheelchair. If I'm going to be laying down, maybe the gurney, even though rolling over onto that thing and getting onto that, it's going to be a nightmare as well. But at least if I pass out, I'm already lying down. I'm not going to fall. So he says, you know what, let me go get someone a little more qualified for your condition. So he comes back with a nurse, and we're all working together, do the rollover, start to sit up, stand up, and same thing. I'm feeling all hot and sweaty again, and I'm like, boss, I'm gonna pass out.
They were gonna take me for an x-ray, but they set me up, and I passed out again.
Nurse is saying, you know what, we're not doing x-rays tonight, we're done. Nurse gets me all situated and stuff like that, goes to talk to the doctor. The doctor orders blood work. I understand it, they gotta check, make sure things are okay. Even though I'm prone to passing out before, they gotta make sure things are, I just had major surgery, they gotta make sure things are okay. So I'm telling the nurse that, you know, hey, I'm probably gonna pass out. And he's reassuring me, you know what, don't even worry, you're not gonna pass out, this doesn't hurt. I'm like, I know it doesn't hurt, it never hurts, it's just for whatever reason, my body doesn't like it. And I usually pass out after the fact. And he's reassuring me and stuff like that, keeping me talking, which is good because it keeps my mind off of things. He's telling me, you know what, I've been in worse conditions, doing stuff like this, putting IVs in people, drawing blood from people, you know, meaning that he's done it as a combat medic with bullets whizzing by and bombs going off. And he's like, what's the worst gonna happen here? Somebody's gonna come up behind me and slap me on the back? He's like, come on, you're in good hands, don't worry. So he draws all the blood that he needs so they can go do the test, make sure my hemoglobin and stuff is at a good level. And then, I swear not, like 2 minutes later, he comes back in. He says something along the lines like, boss, we gotta draw more blood. I'm like, what do you mean we gotta draw more blood? He's like, I just handed that blood in, just talked to the doctor, and the doctor literally just says, yeah, we need X amount more vials. And, you know, he's like, him and I had the same reaction. Like, well, why didn't he say that to begin with so that when you were already in there, you could have had it? I don't know. This is the way it is. Unfortunately, we got to put another needle in you and draw more blood. So same thing goes through. And again, I don't pass out. So that's 2 blood draws after I just passed out trying to stand up. The 2 blood draws, I didn't pass out. Okay. Cool, now it's really late in the night and I would like to get some sleep. So, you know, it's the whole thing of trying to get sleep with the nurses coming in, checking my vitals, with the nurses coming in, giving me meds, and they stagger it. So you really don't have time to sleep at all. It's horrible, and I'm barely moving. So I'm gonna say that's the end of day 1. Hey, wow. If you made it all the way to the end, I gotta say thank you for listening to me. It was a pretty long vlog. I mean, I have a story to tell, and all in all, those 4 days together, it's like an hour and 10 minutes of just me talking. That's quite a bit. I don't talk that much. So I thank you for making it to the end. Definitely check out tomorrow, you know, day 2, and, well, I'll see you there.